How to save vision with diabetes. Diabetes and vision, symptoms you shouldn't ignore. The sooner you start taking care of your eyes, the greater your chances of achieving improved vision in diabetes. 7 tips to prevent vision loss due to diabetes. Control your blood sugar levels and avoid sudden spikes. The risk of complications of retinopathy and macular edema is higher in hypertensive patients, so monitor your blood pressure. A balanced diet, maintaining an optimal weight, and regular physical activity help keep your blood pressure normal. Do not ignore your doctor's instructions and take antihypertensive medications constantly, even if it seems to you that your blood pressure has returned to normal. Control your cholesterol levels. We are talking about bad low-density lipoproteins, LDL, which destroy the walls of blood vessels. Stop smoking, which also negatively affects the condition of blood vessels. Eat a healthy diet that is rich in fruits, vegetables, whole grains, lean proteins, and foods rich in polyunsaturated fatty acids. Thus, scientists have found that omega-3 acid, found in nuts and fatty fish, reduces the risk of retinopathy in patients with type 2 diabetes. Avoid strenuous physical activity. Lifting weights and contact sports can cause microbleeding, which is dangerous for the retina. Once or twice a year, undergo a comprehensive eye examination for diabetes. It will help identify any disorders at an early asymptomatic stage. At first, diabetic retinopathy does not manifest itself in any way, only a doctor can notice changes during an examination. At the initial stage, gentle methods of treating vision for diabetes mellitus are still effective, medications and laser therapy. At an advanced stage, retinal death can only be stopped through surgery, which has its own risks and complications. Remember that the most innovative treatment methods do not restore visual acuity, they only prevent blindness. Contact your doctor immediately if you notice any changes. Soreness, throbbing in the eyes. Blurred image. Spots or floating objects before the eyes. Double vision. Blurred vision. These symptoms indicate an advanced process of retinal destruction. Every time we eat, our blood sugar levels rise, but after 3 to 4 hours they drop to normal levels. In people with diabetes, sugar levels are always several times higher than necessary. Because of this, the functioning of the kidneys, gastrointestinal and cardiovascular systems is disrupted, and vision decreases. A sustained increase in glucose slows down blood supply, therefore, metabolism is disrupted and all eye structures do not receive enough nutrients. The level of intraocular pressure increases, the permeability and fragility of blood vessels and capillaries, the thinnest vessels, and nerves are damaged. Therefore, diabetics are diagnosed with cataract, clouding of the natural lens, which leads to complete or partial loss of vision. Glaucoma is a disease in which the optic nerve dies at the final stage and blindness develops. Retinal detachment, separation of the light-sensitive membrane from the inner surface of the eye and the nerve membrane. Diabetic retinopathy, DR, is progressive damage to the small blood vessels of the eye that can lead to blindness. Currently, DR is the most common cause of blindness after age 50 in the world. Diabetic maculopathy, or diabetic macular edema, damage to the macula, the central part of the retina. Hemorrhage into the vitreous body. Visual symptoms you shouldn't ignore in diabetes. If you have diabetes, I recommend having your eyes checked by an ophthalmologist at least every 6 months. Traditionally, a preventive examination is carried out once a year, but since many ophthalmological diseases develop asymptomatically, and diabetes contributes to their development in every possible way, you can miss the onset of, for example, cataracts or glaucoma. Treatment of diseases and pathologies in the initial stages of development is mentally easier for patients and allows them to regain lost vision. Among the symptoms that require immediate medical attention in diabetes, I highlight the appearance of floaters, black dots, flashes, shadows, double vision, hemorrhages. Periodic blurred vision. Periodic or persistent throbbing pain in the eyes and temples. deterioration of night vision, decreased visual acuity, rapid eye fatigue. Often people with diabetes, when atypical symptoms appear, begin to perform visual exercises, take vitamins, and follow a diet. All this has a cumulative effect and works in the long term, but before floaters, fogging or other symptoms appear. Trying to eliminate them is a bad idea because they indicate a problem, a specific malfunction in the visual system. By eliminating or masking a symptom or symptoms, we are not treating cataracts or glaucoma. Prevention of visual diseases. If you have diabetes, it is important to eat right, eat a lot of fats, but a minimum of carbohydrates, low-carbohydrate diet, high in fat and protein. Play sports, fitness, running, brisk walking, swimming. Take vitamins in courses that will support the functioning of the visual system. But these must be vitamins prescribed by a doctor, taking into account the type of diabetes, the state of vision and health of a particular person, lifestyle, etc. Every 6 months undergo a preventive ophthalmological examination. It is advisable to do this with the same ophthalmologist, who, based on previous studies, will notice the slightest changes in the functioning of the eyes. Therefore, it will be timely to prescribe treatment, medication, surgery, laser. Quite often, patients with diabetes who delay visiting a doctor develop complications. Then laser or conservative treatment ceases to be effective, and the renewal process becomes more complex. Once upon a time, a diagnosis of diabetes mellitus was a death sentence, but modern medicine has everything to improve your life and prevent the development of concomitant diseases or pathologies. The main thing is that the patient takes responsibility for his health and well-being. Therefore, if the slightest changes appear, even temporary, contact an ophthalmologist. The main cause of vision loss in diabetes mellitus is a specific damage to the nerve membrane of the eye, retina, which is medically called diabetic retinopathy. The fact is that in the middle of the eye, on the retina, there are many microvessels that feed nerve cells. In diabetes, the structure of the wall in the vessels changes, the vessels become incompetent, with a large number of holes through which some of the blood begins to spill into the external intercellular environment. This can be compared to a water pipe breaking on the street. There is no pressure in the apartment, and on the street, around the leaky pipe, there is dirt, mud and water. Under such conditions, the nerve cells become hungry, ischemic, and the entire retina swells from excess fluid. New vessels begin to grow towards the hungry cells, which are very fragile and eventually bleed, filling the eyes with blood from the inside. In advanced stages, scars form on the retina, tighten it and eventually tear it off. Complete blindness occurs.